It is done on the skin. There are no needles. The transducer of the ultrasound device is applied to the skin with a gel. And the advantage with this device is that we have a monitor to show us actually where we are in depth. We're able to treat that plane of skin. We're looking for connective tissue that's locked together, and we want to make that tighter. And they're in different planes. So we have different transducers in different depths to affect the improvement we're trying to get. And we're still not advancing this.
That's so strange. Maybe worst case if you reopen it.
It's not even allowing me to escape from it.
In the meantime, one person asked, are you presenting the options in the order you would recommend them for best results?
No, because it does vary on every patient I see. So this is the transducer over here with the ultrasound gel, and you look at the white band, that's the superficial dermis, that's what we're targeting, as well as the deeper fascia right here, this little white scattered line, that's a deeper fascia, that's connective tissue. We're down with energy to heat it and have it contract. It is what we call colorblind, so skin of color, dark skin, we don't tend to get that risk of post-inflammatory hyperpigmentation that can occur with some devices. The improvement with Ultherapy is only in about 6 to 12 months. You might see it even at 2 or 3 months, but the peak improvement, and I will repeat usually at a year if needed, very rarely at 6 months, but I have, but certainly not monthly. The downtime is minimal. When I'm treating the right cheek, it turns red, and as soon as I go over to the left cheek and finish on the left, the right is hardly red for most people. Of course, there are going to be some who are going to be more swollen, more red, so you always want to give yourself downtime of maybe a couple of days just in case, and very rarely is there bruising. It does happen. I've seen one case, I know a physician who saw a case. So these are some before and afters of Ultherapy. Again, much improvement in the smile fold here, much softer, as well as taking the cheek and bringing it up into the mid-face instead of having it hang on the jawline. So this woman has a very prominent jowl, a pretty moderate marionette fold and the smile fold. The smile fold hasn't changed anything with Ultherapy, but there's definite improvement in the marionette line and definitely a more straight jawline. And on men, whereas the bearded skin is thicker and a little more resilient to these external treatments, we do see improvement where this angle is rather obtuse and becomes more acute or sharp. If we work with Ultherapy on the forehead above the eyebrow, we can improve the tightness, which will help pull up the arch of the eyebrow as well as the eyelid skin. But this patient also had thermage, the external radio frequency. I cannot do Ultherapy, ultrasound, on this area, but we do radio frequency on this area. So we see from 2.5 to 3 millimeters of the upper eyelid exposed. We now have double or almost triple that with this patient. Not everyone gets the same good improvement. There are some rare cases where we don't see any improvement.